Hi, Dr. Eric Thomas talking today about wound care. We do a lot of surgery in the office and we have some written directions, but I always am afraid to give them out. I do because I have to, but things vary a lot depending on what sort of wound. Is it clean? Is it this level? Is it that level? I'll try to clarify and throw in a few personal experiences also. First of all, let's talk about a nice, clean, hey, we cut it out, we put in stitches. It was done sterilely and clean. The best evidence is that keeping it very lightly lubricated and protected from injury is a great idea. So the studies were done with just Vaseline petroleum jelly. Most people want to use an antibiotic, a triple antibiotic, but I'd have to tell you that once or twice a year I see people who come in and they think they're infected and actually they had an allergic reaction to the bacitracin or the diamycin in it. In fact, we do patch tests and there's a little talk on that you might want to look at. But among the 36 patches, we have one for bacitracin and one for diasporin. So don't think that triple antibiotics don't have a little risk. You can use them, but my advice is always to put a little bit crook of an elbow someplace like that so that if you start to get irritated there, you'll know that you're not infected, but you're just allergic. Anyway, changing a Band-Aid occasionally is a good idea. Rotating the area where the adhesive is on, depending on which area of your body, it's a great idea too. But what if you have an injury that's not stitched up? What if you have one that's been shaved off? We do that also. And a lot of that talks to realizing that in dermatology we think three-dimensionally, not just the length and the width, but also the depth. And we know that there are certain things, not all, that we can shave off, leaving behind enough of the skin that it will heal up, maybe with a little discoloration or scar, but still in a very nice way. Well, the treatment for that can be very similar. It is important not to bathe the wound in either of these areas with a very, very thick layer of Vaseline or triple antibiotic because that makes it just too moist. Now, there are a couple of personal anecdotes that might be interesting. What happens if you have a traumatic wound that was due to, well, we were on a bicycle trip in Italy a few years back, and my wife dismounted quickly, and her back of her right calf was pretty well injured by the rig gear of the bike. Unfortunately, there's a lot of grease on those and dirt, so we flushed it out. Fortunately, had some cleanser with chlorhexidine in it and just bathed it and bathed it and bathed it. In an ER, they'd actually use perhaps a sterile brush, but didn't have that there. Was really worried until the second or third day there was oozing, and a lot of that retained grease came out, and from that point up it healed pretty nicely. Then another person is 90, more mature mother-in-law, lives in Georgia, and she dropped a little something that took a gouge out of the front of her shin. And we were going down there, so I brought a film type of dressing, won't use a brand name, but that was convenient. And I think there's a town in Georgia, south of Atlanta, that thinks well of film dressings. Took her a few weeks, had to get it dressed a bit, but these dressings go through a shower and also provide a nice environment. Now, I know that may not speak to your issue, but actually advice regarding wounds, yeah, I gave you what is the best practices at the moment for clean, sterile wounds, which is a light, moisturizing, lubricated dressing with protection from injury, but it is more challenging than you think. Now, there are dedicated wound care specialists. I'll give a shout out to them, and I'm grateful that they're around for chronic wound ulcers, for pressure ulcers, which are often hospitalized or partially immobile people. But that goes a bit beyond what I could really talk about today, other than to say they exist, and you should go to see them if your dermatologist feels it's beyond what they can do in the office. So best wishes, and hope that your skin, the wrapping that keeps us all together, that has remarkable repair possibilities, is serving you well, and that you take good care of it. Take care, Dr. Eric Thomas.